Hi, my name is Erin McFall, and today's date is October 3rd, 2023. And today we will be discussing the integumentary system. So, what is the integumentary system? The integumentary system is the skin, and things that come along with that are also hair and nails. But what the main component of the integumentary system is the skin. So the integumentary system is very important to us humans because skin is our largest organ, which is funny to think about because growing up, whenever you think of really important organs, you think of the heart, the lungs, but the integumentary system is very important because the skin is actually our largest organ. So a few things to note about skin before we jump in. It is full of sensory receptors that talk to the nervous system to flag our brains when something is hurting us or giving us pain. And then it does things like regulates temperature, all that good stuff. So to get into the integumentary system a little bit deeper, we're going to talk about the layers and then the components of each of those layers. So to start out with the outermost layer, we have the epidermis. So the epidermis is made up of 5 layers, and it's good to remember that they all start with the word stratum if you're trying to learn about them. Excuse me. So to go through the 5 layers, it is the stratum basale, the stratum corneum, the stratum lucidium, the stratum granulosium, and the stratum symposium. So that might sound a little bit daunting if those are the first time you've ever heard those words, but I would like to note there is a very good resource on YouTube, and it is a crash course about the integumentary system that goes through each of those layers, and it just gives a very good description of each of them, so that helped me a lot whenever I was learning this for the first time. So that is the epidermis. So to go a little bit deeper into the skin, the next layer is known as the dermis. The dermis is a bit more vascular. It has blood flowing through it, stuff like that. So 2 layers in the epidermis is the papillary layer and the reticular layer. So something to know about the papillary layer is the papillary layer has stuff to do with the blood vessels and the lymph. So that is more of that layer's things. And then the reticular layer has more to do with the collagen production of skin and the elastic fibers that cause our skin to have elasticity to it. So what we've gone over is the epidermis and the dermis. And then lastly, the deepest layer of the skin is the hypodermis, which is also known as the subcutaneous. So something to note about the hypodermis is that it is made up of adipose tissue, which is fatty tissue, and there is blood vessels running all throughout it. It's very vascular, stuff like that. And lastly, to discuss a clinical setting that I might see this system working with. Let me start over. In the clinical setting in the future, I'm going to be working in occupational therapy. Something that I might see in an occupational therapy office that I'll be working in is something called pressure ulcers, or just maybe ulcers in general. But pressure ulcers are a bit more strenuous to the body. It causes the body to go into bed rest, stuff like that. So as an occupational therapist, that is something that I will see in the future, dealing with the integumentary system, and my role for treating this pressure ulcer will be helping the patient use their wheelchair, go through the procedures and everything of their everyday life that they will have to do in order to get better, and stuff of like treating them on how to get in and out of the bed, stuff like that. So pressure ulcers is a way that integumentary system and occupational therapy will converge in my future career. So sorry, I was a little bit nervous. I'm not used to filming myself, but I just wanted to chit chat today and talk about the integumentary system and all I know about it. So thank you very much. Have a good day.